But let's go now to NBC's Monica Alba. She's at the White House with some new reaction to this travel advisory. Good to see you down there. Looks like it's a rather dismal day weather-wise there, as it is here in New York as well. But what can you tell us?
That's right, Alex. We saw this quarantine really go from proposal to reversal in just a matter of hours from the president. He first floated it and then said they would be taking a look at it and speaking to the governors of the tri-state area before making any decisions. And it turns out they had a late coronavirus task force meeting here at the White House that wasn't previously on the schedule to discuss how this could work. Take a listen to how Dr. Fauci put it in terms of his conversations with the president this morning. Take a listen.
I think it ultimately will help stop the virus, Jake. We had a very intensive discussions last night at the White House with the president. As you know, the original proposal was to consider seriously an enforceable quarantine. After discussions with the president, we made it clear, and he agreed, that it would be much better to do what's called a strong advisory. And the reason for that is that you don't want to get to the point where you're enforcing things that would create a big of difficulty, morale and otherwise, when you could probably accomplish the same goal.
So that speaks to a little bit of the confusion that was prompted when the president first expressed this as being under advisement. You heard Dr. Fauci there talk about how the CDC travel advisory, which will last 2 weeks, really just encourages what people are already being directed to do, which is to stay at home, to not leave or travel for anything that is considered non-essential. So to see that continue is a sign that that is the kind of guidance they continue to express, that really anything in terms of a quarantine is more going to be up to the states. And we've heard from those governors. You're going to probably hear from Governor Cuomo again here in this hour why that's not the best case for New York right now as the cases continue to rise. And we also expect to hear from the task force themselves. They'll be briefing here later this afternoon, Alex.
Okay, lots of officials with a lot to say. Thank you so much, Monica. You talked about Governor Cuomo. Everyone, let's take a listen to Governor Andrew Cuomo in his daily briefing here about New York.
Day one. And rather than be reactive, be proactive, get ahead of it. Local health providers should be watching what's going on in different parts of the state and anticipating what's going to happen. This is going to be a phenomenon of a rolling apex. We keep talking about the apex, the top of the curve. But the top of the curve will occur at different times in different places, right? The curve is a function of the rate of spread, the rate of density, and when it started. So you'll see different curves. You see it all across the country. It started in Washington, the state of Washington. Now you see New York, you see Chicago, you see New Orleans, you see parts of California. So that rolling apex is happening across the country. That rolling apex is also going to be happening across the state of New York. The current projections all say New York City will face the first high water mark, if you will, high tide mark, the height of the curve. But then you'll see Westchester, you'll see Long Island on a delay with their curve hitting a new height. Model projectors are not sure if it's Westchester first or Long Island first. Some suggest it's Westchester because we had that cluster in Westchester, if you remember, at New Rochelle. And then upstate New York. We expect a curve in upstate New York also. May not be as high, obviously, as New York City, Westchester, Long Island, but there will be a curve. So if you are not in a highly affected health area now, that doesn't mean you're not going to have a real situation to deal with, because these numbers are just going to continue to go up all across the state. So for a local health system, this is a new challenge. Most health systems have public hospitals, and then they have private hospitals or voluntary hospitals. And they basically exist on a day-to-day basis as two different systems. So you'll have public hospitals, and then you have the private hospital system. And for all intents and purposes, in normal operating procedures, they operate as two systems. There's very little interaction. There's also very little interaction among individual hospitals sometimes even within their own system. So you have public hospitals that are part of a public hospital system, but each hospital basically operates on its own, right, has its own identity. Certainly true on the private side, where you have individual hospitals and they operate on their own. We have to change that mentality, and we have to change that mentality quickly. No hospital is an island. No hospital in this situation can exist unto themselves. We really have to have a new mentality, a new culture of hospitals working with one another, both within the public system as well as the private system. And we need to think about the public system working with the private system in a way they never have before. There is an artificial wall almost between those two systems right now. That wall has to come down. That theory has to come down. This is going to be all hands on deck. This is everybody helping everyone else. One hospital gets overwhelmed, the other hospitals have to flex to help that hospital, and vice versa. We have Elmhurst Hospital, for example, in New York City, that is under stress. The number of cases in the Elmhurst Hospital is high. When the number of cases is high, the stress on the staff is high. I was just speaking with Dr. Zucker about this. You do this for 2, 3, 4 weeks, the level of stress is very intense. Elmhurst Hospital is part of a public health system of about 11 hospitals in New York City. That system has to work together, and those hospitals have to work together. The 11 health and hospital in New York City, the public system. And I'm going to ask Mayor de Blasio and Controller Stringer to take a look at the system and figure out how we can get that system to work better together as a unified system. This is not going to get better soon, right? So Elmhurst is under stress now. That stress does not abate for this foreseeable short-term future. So how do we make that system work better together? And what recommendations do we have to improve H&H? We'll also be meeting with the private hospitals in New York City that are organized through something called the Greater New York Hospital Association. I'm going to be meeting with them tomorrow to talk about having those hospitals also organize, act as one, get out of their silos, get out of their identities to work together. And then overall, you have these local health systems. The state's role, which we've never really done before, is getting those health systems to work with one another. So we talked about if New York City gets overwhelmed, we'll ask the upstate systems to be a relief valve for the downstate health systems, which has never happened before to any scale, and also vice versa. There will be a time where the upstate hospitals will be struggling. And when the upstate hospitals will be struggling, then we want the downstate hospitals to be able to take over and relieve those hospitals. That's actually the advantage of the rolling curve that they're projecting. If it does happen that way, theoretically, I almost think of it as a high tide mark, right? High tide comes first in New York City, then the tide is on the way down, and then it's high tide in upstate New York. Okay, so if the tide is dropping downstate, then you have some relief for the upstate hospitals. We put in place the New York Pause program. Today, I am going to extend it to April 15th, the directive that non-essential state workforce continue to work from home. We're doing it in 2-week intervals because every day is a new day, and we'll see what happens day to day. But I think it's not even questionable today, but that we're going to need 2 more weeks of non-essential workers. Good news, Wadsworth has developed the New York State Department of Health has developed a less intrusive saliva and short nasal swab test. I'm not exactly sure what a short nasal swab test is, but my guess is it wouldn't apply to me. It can be administered in the presence of healthcare workers. It requires less PPE. Healthcare workers can self-administer it. So kudos to the Department of Health on that. It also helps them limit the exposure for healthcare workers, and it should start as soon as next week. People ask, when is this over? I think the testing, you tell me when they come up with an inexpensive home test or point-of-care test that can be brought to volume. I think that's probably when you see a real return to normalcy in the workforce. In other words, we're all talking about this curve, flatten the curve. At what point on the other side of the curve do you go back to work? Jesse asked this question the other day. There is no answer. I think the answer is going to be in testing. Dr. Fauci, who I think we're so blessed to have him here at this time, he talks about faster, easier testing. If you can test millions of people, if you could test today millions of people, you could send them to work tomorrow, right? So the development of these tests, I think, are very important and instructive. Tomorrow, the USNS Comfort is coming. That is about 1,000 bed capacity. It's staffed by federal officials, federal medical professionals. It is not for COVID patients, but it is to take the backfill from hospitals. Current stockpile, we're still working to purchase and equipment all across the globe. We have a whole team that's working 7 days a week. Unfortunately, we're competing against every other state in the United States for these same things. So it's very hard, but we're making progress. In terms of finding staff, that's going very well. The volunteerism of New Yorkers, God bless them, we're up to 76,000 healthcare workers who have volunteered. 76,000. 76,000 people who volunteer to go into these hospitals at this time. Just think about that. On the total people tested, we did 16,000 last night. Total of 172,000 tested. That's the highest in the state, highest in the country, I'm sorry. Positive cases, 7,000 last night. Total cases, 59,000. The virus continues its march across the state of New York. Only 2 counties now that don't have cases. These are the overall numbers. 59,000 people tested positive, 8,000 currently hospitalized, 2,000 ICU patients, 3,500 patients discharged. Nobody really points to these numbers, but this is good news. 846 people came out of hospitals yesterday, discharged, after being treated for COVID, right? So, yes. People get it. 80% have either self-resolve or have some symptoms at home. 20% go into the hospital. Majority of those get treated and leave. It's the acutely ill, by and large, who are the vulnerable population. And that's what we're seeing more and more. The deaths went from 728 to 965. What's happening now is, as I mentioned yesterday, people are on the ventilator longer and longer. The longer you are on a ventilator, the less your chance of ever getting off that ventilator. And that's what we're seeing. And we will continue to see the number of deaths increase. In terms of most impacted states, again, New York is still #1. Total new hospitalizations, these are the charts we look at every night. The number is up, 1,175. It was 847 the night before. These bounce night to night. Any one night's data could have a number of variables in it, what hospitals actually reported, when they reported it, how accurate they were. So more you look for a trend line more than anything else. And there are trend lines. If you look early on, the hospitalization rate was doubling every 2 days. Then it doubled every 3 days, then it doubled every 4 days. Now it's doubling every 6 days. So you have almost a dichotomy. The doubling rate is slowing, and that is good news. But the number of cases are still going up. So you're still going up towards an apex, but the rate of the doubling is slowing, which is good news. Change in daily ICU admissions. You see a tick up in the ICU admissions, but again, you look for the trend line among those columns more than the individual columns. Change in daily intubations. We don't normally run this chart, but these are the people who are most seriously affected. And again, you see a trend line in that. You see some aberrations, March 26th, the 290, but you see a trend line. And the trend line is what we're watching. You also see a trend line in people being discharged, okay? And this is a dramatic trend line. So people came in, they started to get treated, only March 18th, right? So we're only talking about 10 days. They started to get treated. A few of them got out early, a few more, a few more, a few more, a few more, and now you're seeing the discharge number trend way up, because that's what's going to happen. People go into the hospital, they get treated, they leave. Those that are acutely ill get put on a ventilator, and then it's the inverse dynamic. The longer they're on the intubator, the longer they are intubated, the longer they are on the ventilator, the higher the mortality rate. Again, perspective, these are the numbers from day one since China started. Also, we should all keep in mind, we lost the first responders who go out there. I was talking about the 76,000 people who volunteered to help medical professionals. Being a first responder today, being a public health official, working in a hospital, working with senior citizens, this is really an act of love and courage. We lost Detective Cedric Dixon, 48 years old. 32nd, 23-year veteran, could have retired. So we wish him and his family peace. We lost a nurse. We've lost a couple of other nurses. Kaios Kelly, 48 years old, who was the assistant nurse manager at Mount Sinai West. We wish his family the best. These public people, I don't even have the words to express my admiration for them. FDR always had words. Courage is not the absence of fear, but rather the assessment that something else is more important than fear. To me, that says it all today. Everyone is afraid. Everyone is afraid. You think these police officers are not afraid to leave their house? You think these nurses are not afraid to go into the hospital? They're afraid. But something is more important than their fear, which is their passion, their commitment for public service and helping others. That's all it is. It's just their passion and belief in helping others. And that overcomes their fear. And that makes them, in my book, just truly amazing, outstanding human beings. And I wish them and their families all the best. The President and the CDC ordered a travel advisory for people of New York, New Jersey, and Connecticut. This happened last night. This is not a lockdown. It is a travel advisory to be implemented by the states, in essence. It's nothing that we haven't been doing, right? Non-essential people should stay at home. So it's totally consistent with everything we're doing. And I support what the president did because it affirms what we've been doing. It also affirms what New Jersey and Connecticut have been doing. Rhode Island issued an executive order that New York license plates would be theoretically stopped at the border for mandatory quarantine of some period. That executive order has been repealed by the state of Rhode Island, and we thank them for their cooperation. That was repealed last night. Personal opinion, not fact, gratuitous. This is disorienting, it's frightening, it's disturbing. Your whole life is turned upside down overnight. To the best you can, you find a way to create some joy. You try to find a silver lining in all of this. How do you break up the monotony? What do you do? How do you bring a smile to people's face? I'll give you my idea for today. Sunday, I come from an Italian-American family. Sunday was Family Day. We had the big family dinner, but you'd have like in the afternoon, so it was like a little confusing, but it was like a lunch, late lunch they called dinner, and it was spaghetti and meatballs and sausages, and my family would all get together, and it was a beautiful time. I didn't really appreciate it as a kid, but it was just beautiful because they all came together and the grandparents were there and they would start to eat at 2 o'clock. It was like a marathon session. The food was really just the attraction to get people together. You know, everybody talks about how the Italians love the food. That's true, but really they love bringing the family together, and the food was the way that people came together. And then you sat at the table, and it was just a 2-3 hour affair. My mother and father did it also. Not to the same extent my grandparents did it, but we had that same Sunday dinner around the table. I tried to continue it as a father with my kids. I was divorced, and so I'm not really the best cook, to say the least. But we would have, on Sundays, I would actually go to the Italian specialty store and I would buy the meatballs and buy the sausages and buy the sauce, but I would put it in a pot and I would put it on the stove. And because part of it was that sauce would sit there all day and it would just simmer, you know, and you'd smell it all through the house. And then I'd make them sit down and we would have spaghetti and meatballs and sausage on Sundays. And my daughter Cara is in the back. They would never eat the sausage and the meatballs. They would pick at the pasta because, see, they knew I didn't know how to cook, so they knew that meatball and sausage was inherently suspect. And I never said that I bought it in the specialty store because that would have ruined the whole tradition anyway. So they wouldn't eat it, and we'd go for Chinese food afterwards. But that convening was something special. And today we're going to have our family dinner. We're missing one daughter, Mariah. We're going to get Mariah on Skype, and Grandma's going to be on the telephone. And we're going to sit around the table, and we're going to have that kind of coming together, a little different, Skype, telephones. But you know what? With everything going on, family, we're here, we're together, we're healthy. That's 98% of it. So find ways to make a little joy. Also for New Yorkers, I know we feel under attack. I had a lot of phone calls yesterday when the president first suggested some form of quarantine. What does that mean, quarantine? Am I going to be allowed to leave the house? So my parents who are supposed to be coming back, and this one's here and this one's here. I know we feel under attack. The Rhode Island, you can't drive into Rhode Island, we'll pull you over with the police. Yes, New York is the epicenter. And these are different times, and many people are frightened. Some of the reactions you get from individuals, even from governments, are frightening and suggesting that they'll take abrupt actions against New York. But look, this is New York, and we are going to make it through this. We have made it through far greater things. We are going to be okay. We specialize in stamina and strength and instability, and that's just what we're doing now. We are strong, we have endurance, and we have stability. And we know what we're doing. We have a plan. We're executing the plan. Any obstacle that we come across, we will manage that obstacle. And we have. I can't sit here and say to anyone, you're not going to see people pass away. You will. That is the nature of what we're dealing with, and that's beyond any of our control. But New York is going to have what it needs, and no one is going to attack New York unfairly, and no one is going to deprive New York of what it needs. That's why I'm here. That's why we have a state full of very talented professional people. So a deep breath on all of that. And we are doing exactly what we need to do. There is no state in the nation that is better prepared or better mobilized than what we're doing. And I feel that deeply, and having studied everything that every other state has done. Federal officials have even remarked to me that they're surprised how quickly a state as big and complicated as New York has actually mobilized. So feel good about that. There are two great New York expressions that I use all the time. Anything I build in New York always has two expressions on it. One, Excelsior, says it all. Ever upwards, aspirational. We can be better, we will be better. We're going to aim higher, we're going to improve ourselves. Excelsior, state motto, it's on the seal behind me. Excelsior. And the other, e pluribus unum, out of many one. Unity, unity. You put those two things together, it says it all. Aim high, do better, believe you can do better, be optimistic, and the way you get there is through unity and togetherness and cooperation and through mutuality and community. Those two expressions. I say to my daughters, if you remember nothing else when I'm gone, if you walk up to the box and have nothing else to remember, Excelsior, you can be better, it will be better, we can make it better. E pluribus unum, we make it better together. That's it, and that's what we're doing. Questions?
So when are we going to start funneling patients into Javits?
Say again?
When are we going to start funneling patients into Javits, and how is that process going to work?
When are we funneling patients into Javits? Javits will be coming online this week. Also remember, a lot of what we're doing is we're building capacity and assembling supplies for the apex. You get these people who say, well, you don't need this today. Yeah, I know I don't need it today, because I know where we are in the trajectory today. I have to prepare for the apex, for the curve. That's where I need the beds, that's where I need the supplies, et cetera. That's when I say get ahead of this thing, right? The virus has been ahead of us. I want to get ahead of the virus. I want to get to that apex before the virus gets to the apex. So the Javits is part of that supply, but it will be coming online this week. When we actually utilize it is when we need it. Karen?
I mentioned family dinners a moment ago. Obviously, the stay-at-home order through April 15th affects Easter and Passover, so that means that people can't go to church, can't have seders. You know, what advice do you give them?
It's hard. It's hard. But on the flip side, I say, look at what happened in New Rochelle. Those gatherings brought people together, were religious gatherings, and brought hundreds of people together, which was beautiful, but it made many, many people ill. And density is the enemy here for this particular time. So you worship the way you can, but the gatherings are just not a good idea.
So just to be clear,
by the way, the patient zero, what we call patient zero in Westchester, New Rochelle, who was very sick for a very long time, he has actually gone home. Am I correct in that?
Just went out of the hospital.
He's out of the hospital.
Have you spoken to the governor of Rhode Island, and if so, how did you convince her to take back the sort of travel issue?
I spoke to the governor of Rhode Island yesterday, and we had a conversation. I don't think the order was called for. I don't believe it was legal. I don't believe it was neighborly. I understood the point, but I thought there were different ways to do it. And the governor of Rhode Island was very receptive, and I thank her very much for reconsidering her position.
Governor, 237 deaths in the last 24 hours in the state of New York, 222, it seems, in New York City. What are your projections showing in terms of what this apex might look like in terms of fatalities? Are we talking hundreds of people, thousands of people? What are you seeing inside?
Jim, Howard, do you know?
Sure. So, there's many different projections that we're working at, and it does see that will be already we're at 965, and so we do see in the thousands. But again, these are models, and we have to plan for what the model may show, but hopefully it'll be less.
And just to psychologically prepare New Yorkers, are we talking hundreds of deaths a day, thousands of deaths a day?
So it goes back to the numbers. We've always said that 80% of individuals get better. And we've said that of the other 20%, some end up in the hospital, and there's a small percentage that end up, unfortunately, dying. And that percentage, as we're looking at it, the numbers, is actually hovering around 1 or even less than 1%. So again, it's determined by how many people are positive.
But isn't it
Opinion, Jesse, not data-driven. I don't see how you look at those numbers and conclude anything less than thousands of people will pass away. Because remember who it's attacking. It's attacking the vulnerable, underlying illness, etc. And I don't see how you get past that curve without seeing thousands of people pass away. I hope it's wrong, but...
As of Friday, like nursing home residents were about a fourth of the coronavirus deaths in New York City. What more can the state do to tackle that issue?
Nursing homes are about a fourth of the coronavirus deaths. Frankly, we are lucky that it's only 1/4. Coronavirus and a nursing home is a toxic mix. We've said that from day one. We saw that in Washington State. This virus preys on the vulnerable. It preys on seniors. It preys on people with compromised immune systems and underlying illnesses. And coronavirus in a nursing home can be like fire through dry grass. The state has put in different precautions. We're not even allowing visitors into nursing homes now, which is really harsh, frankly, unless the person unless what we call there are exigent circumstances where the person is in a desperate situation and then the family comes in to see them. The staff is being tested before they go in. So we're doing everything we can, but this is a truly terrible virus to stop, and that combination is lethal. Coronavirus in a nursing home is lethal. The only question is how many people will die. I'm sorry, Jimmy.
Your order, you're extending the entire pause order, so that's all non-essential workers and all unnecessary gatherings through April 15th?
Yes.
Okay. And then to go back to the point that Dr. Zucker was making, Obviously, we're testing at a very large rate, so we're getting a lot of more positives, maybe compared to other jurisdictions. So what numbers are you actually looking at? Do you look at the rate of hospitalizations? Do you look at the rate of ICU intubations? Like, the data seem to be saying different things.
You look at all the numbers. We look at all of this. We look at the trends. It's very important to look at the trends, as the governor mentioned, that it is a trend that we need to follow, whether it's intubations, ICU care, and obviously we look at the case fatality rate, which is the number of people who have died, which is the number over the larger number of people who have tested. New York has tested many people, more than anyone else.
Yeah, Jimmy, if I can on that. The question was basically, what numbers do you look at to make a projection? As Dr. Zucker said, you look at all of them. But I would not look at the testing numbers. I wouldn't overweight the testing numbers, because the testing numbers are not random. The testing numbers are all self-selected, right? These are people who you're testing because they're suspect of being positive. And we don't do the projections ourselves. We have Columbia Weill Medical Center that does projections. The CDC does projections. We have McKinsey Company that we hired to do projections. So there are a number of firms that do these projection models. And they go back to studying China and South Korea and everything else. And they have models. The models, some of the models are all over the place, right? So we do the best we can to pick a reasonable model. Not the highest, not the lowest, a reasonable model, plan for that model, plan for that apex. That's where we got from day one, 140,000 hospital beds, 40,000 ICU beds. That's from that model at the apex. At the apex. Well, you don't need 140,000 hospital beds today. Of course not. We need them at the apex. But that's where we got those original projections. Then you have actuality, right? Which is what you're pointing to. You can see the day-to-day, how many come in, how many go out, the discharge rate, the death rate. And that's what we're plotting. And then they take every day and they put it against their projection. But you still only have a projection. They still can't tell you. They're watching for the slowing of the number of cases. And when you see the number of cases, the increase in the number of cases slowing, then you are theoretically reaching the apex. And otherwise, you just watch it day to day.
You talked to Governor Raimondo about sort of stopping New York plates at the border. What about Governor DeSantis in Florida? We're hearing that that's happening on I-95.
I did not hear that. I didn't.
Will you be talking to him? I know that there are clear restrictions in Florida in place on New Yorkers or people coming from New York.
Yeah, Jimmy, I don't know what Florida did, but I will look into it. Let me just go.
Three-part question for you.
You don't get a three-part question. You get two parts.
Okay.
Take first and second part, put them together in one part. Okay.
I will do that. Moving forward, what is your plan for what might be considered by the experts a mental health crisis pending? And then, as people are cooped up together, domestic violence is expected to rise. And then, do you get crime reports and the crime rates down?
All good questions. Doctor, do you want to comment on them, or Jim, you want to talk about the mental health program?
The mental health program, we have a volunteer program. We have nearly 12,000 mental health experts and professionals who have signed up to offer services to New Yorkers, either via telephone or Skype or other things. So that program's going quite well, of psychologists and psychiatrists and other mental health experts to help with that. We are tracking criminal justice.
Are you expecting to do something that's more New York State centric as opposed to this national type thing with people, where mental health experts from all around the country could offer Skype and other?
Many of the people, well, people are Skyping because we want to limit distance. We want people to distance from one another now. So many of those volunteers that I mentioned are actually New Yorkers who are just giving their time and expertise to help New Yorkers in need right now. It's very New York centric.
Please comment on it.
Yep, that's right. That's right.
The domestic violence question that I asked about.
Jim Moore, Howard, do you want to take that?
We've been tracking some of that data. It's tough to tell how it's emerging. We have seen there's some anecdotal instances of increase of domestic violence issues, and the Department of Health and other government agencies have been monitoring and trying to provide services where possible. But I would defer to Dr. Zucker on how.
As Jim said, we're working with all the different agencies across the state on this issue, Office of Mental Health, and all the other agencies. And I've also reached out to some of the professionals in the private sector to ask some of the recommendations they may have.
Sure.
I appreciate it. Could you kind of please speak to, there was ample warning before coronavirus touched down on New York shores that there should be large mass gatherings should be banned, all gatherings should be banned, there should be large workplace restrictions. Why didn't you shut down the state sooner?
I think we shut it down. I think we were one of the first to shut it down. You know, shutting it down is not without criticism either, right? You're trying to balance this. You now have the conversation about when do you bring the economy back, right? When do you open it up? Shutting it down is a very drastic measure. But I think we were one of the first. Also, you want to do it in a way that doesn't create more fear and more panic. You're fighting two things. We're still fighting two things. Last night we were fighting two things. You're fighting the virus and you're fighting the fear. I can't tell you how many people called all night long about the mandatory quarantine comment that the president made as he was getting into a helicopter, which was inconclusive, by the way. Even if you heard his comment, he was not conclusive in his comment. But people are so on edge. I mean, it really panicked people. They were going to leave the city last night. It was really. So you need to manage that fear and the panic, and you also need to deal with the virus. We were one of the first. I never used the term shelter in place because I believe that was an inflammatory term and incorrect, by the way. They still use it. Nobody has a shelter in place policy. Shelter in place was from the nuclear war threat, go to a room in the middle of your home that has no windows, stay there until they give you the all clear sign. What? Modern times, it was for an active shooter concept or in schools. That's not what this was. But you say that, nuclear war, active shooter, you know, so it's how you do it. But we were one of the first to do it.
People are dying at such a quick clip now. Do you regret not, you know, placing more restrictions sooner, closing schools?
I think we were the most dramatic at basically the first point.
Can you tell me how many, or do you know how many medical professionals in New York or other frontline first responders have the virus, have tested positive? Are you hearing from hospitals and other folks?
We don't have a statistic on how many first responders specifically proved positive.
Senator Schumer's office says you're just flatly rejecting $5 billion in coronavirus Medicaid funding for New Yorkers because you're not willing to delay the Medicaid reforms until the federal funding runs out. And, you know, these offices, you just can't hurt local governments, especially at this time. You know, what's your response?
Well, I say to Senator Schumer, it would be nice if he passed a piece of legislation that actually helped the state of New York. The piece of legislation he passed stopped the state from a process that was happening for 6 months, which was redesigning the Medicaid program to make it more efficient and more effective. It was called the Medicaid Redesign Team. I announced it back in January. It's the second time we did it. And it takes waste and fraud and inefficiency out of the system. And that was going on since January. The legislation he passed said you can't redesign Medicaid. For what reason, I have no idea. So it disqualified this state from funding. And he knew that when he passed it.
Well, it didn't
because
you have the choice. You could either take the additional $6 billion in FMAP and pause the MRT, which is worth $2.5 billion, or you could. It sounds like you're not taking the $6 billion and you're going to push ahead with the MRT.
Yeah, I have no choice because on the let me just I'll tell you. 2.5 billion per year recurring is worth more than 6 billion one shot. I'd rather have 2.5, 2.5, 2.5 than 6 billion today. And I called every congressional representative and told them, why would you want to stop a Medicaid redesign that's been going on since January? I don't know what their political calculus was, but that's all it was a political calculus. There's no good government reason to say why you would want to stop a Medicaid redesign headed by Dennis Rivera, former head of 1199, Michael Dowling, top healthcare professional in the state, passed by the Assembly and the Senate. A state-passed Medicaid redesign effort. Why would you ever want to stop that? I don't know whose politics they're playing, but they didn't represent the people of the state.
Maybe you could just do that next year. Why not take the money they're offering you now because you need it and just redesign it next year?
You want to interrupt me?
So one of the numbers here are important. The $6 billion number, we can't get to the $6 billion number no matter how you estimate those numbers. It's probably closer to about $4 billion, and that assumes that the emergency is in place for a full year. There's nothing in that bill that says that it will last for a year. In fact, it will end as soon as the president declares the emergency is over. So that could happen at any time. So that $4 billion number also is reduced. If it's half a year, it's 2. Then a significant portion of that money doesn't come to the state. It went to local governments. So you're left with a number that's under $2 billion, potentially, if at most, which then you're basically saying, take a one-shot of these funds, don't reform the Medicaid system, and spend that money inefficiently on a system that unanimously everyone on there understood was not working properly, we're wasting the money. So the choice is really waste the money that way, or do a bill that actually provides funding to New York State. That bill doesn't even give us a fraction of the amount of money that is needed.
Obviously, this is one of the big sticking points for the budget. Can you offer an update on where
It's not the sticking point for the budget. But just so you have a fact, it's $2 billion. Take $2 billion for sure, right? Door A, door B. Take door A at $2 billion for sure, or door B for $2.6 billion. I pick the door with $2.6 billion. Not because I like the letter B, but I picked $2.6 billion. The real question is...
All right, everybody, we're keeping a very close ear as to drilling down to the nitty-gritty of New York State and the budget there for New York State, for the medical aspects there. But want to let all of you know, for those of you who've been wondering why New York Governor Andrew Cuomo has been garnering the nickname America's Governor, I think you saw it right there. He is conveying incredible strength in the face of this pandemic, putting forth a positive and very unified focus on this day. And he is taking any and all questions and answering them quite directly in extraordinary detail. It's something to see, frankly, of this state's leader. And also, for those of you who find a little bit of charm from the Italian-American side of him, I don't know about you, but it would be kind of fun to be invited to his family spaghetti and meatballs dinner. That was something that I think garnered a chuckle for many of us. That said, we do have some details to get to here, and to do that, I'd like to be joined right now by NBC News medical contributor Dr. Kavita Patel. She's also a fellow at the Brookings Institution, former White House health policy director for the Obama administration. So let's talk about the numbers that we saw. First of all, a positive spin, something in the 800 range of people who've been discharged from the hospital. That was over a 10-day period as compared to those today, rather measured by yesterday, 800 discharged, about 130 or so discharged way back 10 days ago on the 18th of March. Put that in perspective for us. Is it because so many more have been admitted to the hospital as this virus has taken hold of New Yorkers? Or how do you read it? Is it a good sign?
No, absolutely, Alex. And it's a good sign in the sense that we are not letting people go home unless they're actually, number one, they're better, And number two, that they're clearing the virus, meaning they're testing negative for the virus. So that is a good sign. And, you know, the science of how we do the clinical care for coronavirus COVID-19 patients is literally evolving, meaning we're learning more and more. So it's a good sign, but it does also reflect the fact that we have that much more of a burden that we are anticipating. And I think you heard the governor at the top of his press conference really emphasizing this kind of, he called it like a public-private type of partnerships and how the hospitals are going to be working across the state. And that reflects this surge that has hit New York, but is expected to kind of go across the state.
Yeah, and he's talking about, when queried about the Javits Center, when that would be opened up, he said that will come online this week. But he says, look, I know right now I don't necessarily need all those beds that are being set up, but we're trying to get ahead of this curve, ahead of the apex that he knows is coming. It sounds wise to me, but from a medical perspective, your vantage point, the setting up of the Javits Center, and as he wanted to do, he stated yesterday in his news conference, every single borough here in New York, this is the kind of thing that I would think needs to be done all across this nation, advance warning and advance preparation.
Right. And the reason he wanted to kind of put a little bit of a caveat on the Javits Center is for exactly that reason, Alex. You want actually for there to be excess capacity. I mean, think about it during even like a wartime. You don't want there to be only enough beds based on what your needs were for the day before or even the week before. You really do want to kind of over prepare. And you're absolutely right. By the way, I can't think of a single hospital in this country that's not thinking about this, but it does take, just like the governor said, it takes a lot of, it's not just one hospital or one clinic that can do this. It does take a lot of cooperation, again, from kind of local and regional, state, and even federal officials. So he is right. In fact, I hope my friends that are on the ground in New York, none of us hope the Javits Center is full. We're hoping, though, it is a kind of a last resort.
Yeah. What do you make of the stated 76,000 medical professionals, first responders who are volunteering their time right now? I read an article about those in the military who've since been discharged and they are being called back. They are happy to do their part. It really speaks in extraordinary terms about your profession. But when you see these colleagues of yours, those past and present, people coming out of retirement even to help out, how does that make you feel?
No, it's Alex, it warms my heart. And if there's one thing I know in the district where I live, the Reserve Corps, same type of phenomenon, has been so oversubscribed. They have so many volunteers with medical backgrounds that want to help. And these are people like myself who know that we might not have the protective equipment we need, and we just need to go and do our duty. But, you know, just like I think Governor Cuomo gave a passionate kind of remembrance to the detective that lost his life. I mean, this is kind of a calling of duty. And honestly, it's why I think that when we think about silver linings or positive moments, think about everybody in America stepping up to do their part, helping a neighbor, and especially healthcare professionals.
Yeah, absolutely. All right, Dr. Kavita Patel, we've taken enough of your time for this particular hour. We'll be drilling down with you again. Thank you so much. So the governor addressed this, everybody, and it's a very sad result of this pandemic. The endless stories of heartache and hardship, trauma, tragedy, no more numerous in this country than right here in New York City. MSNBC contributor Mara Gay of the New York Times writes about it in a poignant piece that is titled, "My City is on the Brink of Disaster. Here's What It Looks Like." I'm very glad to welcome Mara right now. Mara, it was a wonderful, wonderful article, put so much in perspective. It even brought a smile to my face, which was very welcome. But let's talk about what you see as we start, first of all, with the passage in which you wrote, I'm going to quote, "Every day we worry, we wonder if our neighbors can pay their rent, we go stir crazy, we pray, we wait for help from a federal government we fear may never come." Tell me what you've witnessed, Mara, that alludes to that despair.
Well, it's funny. I actually, ironically, was writing about the sense of purpose and hope that New Yorkers, my neighbors and my family and friends and colleagues have been finding in this horrible time, in this crisis. We hear ambulances at all hours of the night and the day. It's a loud city, but it's very quiet right now because stores and schools are closed. So all you can really hear is the ambulances. We all have a friend or two or three or five that is sick. Everybody at this point, knows someone or knows of someone who has died. I've written about people, including a New York City paramedic who is fighting for her life, Crystal Cadet, right now in the hospital. We're just praying for her. But I think what I've found is that New Yorkers are, as other people are, humans, Americans, resilient. And we've started to get into a sense of rhythm. Governor Cuomo has helped with that, certainly. But I think we know what we need to do now. We need to stay home as much as possible for as long as we need to. And we need to try and help one another. There's a lot of Kickstarters that are cropping up, for example, to help bartenders that are out of work, paramedics, other folks who are sick, that kind of thing. But also just looking forward to picking ourselves back up on the other end, because the hope is really how you keep up the fight.
Yeah. Give me your impression of Governor Cuomo. I identified him as something I keep hearing ringing around, that he's America's governor right now. What is it about him and the way that he's handling this that you think would warrant that nickname?
Well, I think that it's going to be a while before the final narrative is written. I do think there are questions for the federal government especially, but certainly also for governors and other public officials about why we did wait as long as we did to shut things down and have people shelter in place, so to speak. That said, we're all building the plane mid-flight, as they say. And I think at this point, Governor Cuomo has been very impressive in just getting the state what it needs, the resources it needs. He is somebody who knows how to use the levers of government to get his citizens the masks, the medical supplies, the personnel that we're going to need. And frankly, New York also has capital to do that. Yeah. It's a wealthy state. It has a high poverty state as well. But other states may have an even harder time. So he is showing to be a model in that sense. He's got people all over the world looking for ventilators right now. It's impressive.
Yeah, it is impressive. Also impressive was a quote that you used to illustrate your message. It comes from Winston Churchill. I know you're reading that Eric Larson book that's become really popular right now, but you quote it as being, "It would be foolish to disguise the gravity of the hour. It would be still more foolish to lose heart and courage." Why'd you include this quote, rather?
I tend to be an optimist, and it's not out of a sense of naivete. My family and friends are struggling. We are all struggling right now. But I really do, again, I think that hope is a very powerful thing. Yeah. And, that is what allows us to continue this fight. And New Yorkers have been through a lot. We've been through 9/11. We're a city, of immigrants and of people who came to, make a dream come true with nothing in their pocket. It's a tough city, but it's also a city filled with neighbors, and it's my home. And I have faith that we're going to make it through if we help one another.
Yeah, well, I got to say, I think when you said inadvertently the word family, I think that's about true. I think we all feel like family these days. And can I also say, I so enjoyed reading about you walking across the Brooklyn Bridge, finding a bagel with your good friend Emma, and having a 6 foot apart breakfast and just seeing each other, and then walking the streets of Manhattan. I tell you, it almost brought a tear to my eye. It was beautiful. So thank you for sharing that. We really appreciate it, Margaret.
Thank you.